And now we will go to Dr. Diego Maggio. He will present La Bocca, the mouth. I will make a short presentation of also he graduated in osteopathic medicine from Westminster University in London in 2007. He's a member of General Osteopathic Council in UK. He's an international teacher of craniosacral therapy and stomato-emotional release. He was born in Trieste, Italy in 48 and moved to Liverpool at the age of 17 and lived there for more than 30 years, where he worked and studied. He became aware of Apleger's craniosacral therapy, and while working as an osteopath, he specialized with Dr. Apleger to become an international teacher and certified himself. Then in 1995, he returned to Italy, where he engaged a contract as a professor in 3 Italian universities. He's currently co-president of the Craniosacral Apleger Italy, which he founded in Trieste in '96. And he's working in his own clinic. Dr. Maggio worked also with Dr. Apleger as his assistant. In recognition of Dr. Maggio's work over the years, he accepted the lifetime honorary present of the Apleger Italy title. And none the least, he's author of the book Craniosacral Therapy in the Cycle of Life, Ode to Life, which was published in Italy in 2019. And this book was translated in 5 languages by Apleger International. So I give now the floor to Dr. Diego Maggio.
Thank you for inviting me. I'm in the middle of teaching now. I've got a short break, so I'm teaching medical doctors about craniosacral therapy and manual medicine. So I'm taking a little break just to be with you because I think it's an important thing. I wish I could stay longer. Yeah, and I just seen the latter part of the last presentation, and I am in awe. You know, I mean, the work that you do is just incredible. So I will say something briefly, as much as I can. My time is short because my students will return. What about other aspects of the treatment? In other words, Apleger talks about the mouth as the avenue of expression. So we know the work that you do in terms of we are aware of it. If we don't, we understand, but we don't know how you do it because it's a marvelous thing you do. But craniosacral therapy and other modality could be considered as valuable part of the patient well-being, because I came into at last to the final relator who said it will take years to adjust something. Indeed, the body does take years, but it needs a lot of help, not just from one discipline. I think we consider the body as an holistic structure, and as such, as a holistic structure, we have mind, body, and spirit. So we have to be honoring the physiological aspect, the anatomical aspect, but of course we must not dismantle, disregard what is the holistic aspect. So craniosacral therapy looks at any dysfunction of the temporomandibular joint articulation, as I wrote the article about it, in an holistic way. In other words, any fascia dysfunction, any fascia anomaly may modify your bite. You know, if you're wearing, if a lady wear high heel shoes, the modifications is apparent. Okay, I'm still here, yes. So what we're going to look at is the mouth as avenue of expression in considering what is the physiological aspect of it. Now, we're talking about the body. Body is a unit, mind, body, and spirit. So let's look at the mouth. The mouth is in dysfunctions. So we look in terms of trigeminal nerve, which is the nerve that Pleasure consider a nerve which is an auxiliary brain, because it's the only nerve in our body that governs the muscles that open and muscles that close the mouth. So this trigeminal nerve has a connection with the reticular system, and the reticular system has a subsystem called the reticular alarm system, which is connected to the limbic area, to the limbic system, which is the midbrain, a mammalian brain. And this is where the area where we store our emotions. So any kind of impulses which are activated or are hyperactive have an effect on the trigeminal nerve. And the trigeminal nerve then, by reaction, would then work onto the muscles. And therefore, when we come in terms of overuse and stress, modified what we call the modification of the occlusions. So what we have to work on is physiologically to work on the muscle structure, on the mobility of the intracranial membrane, which interfere with the temporal bones, and work with what is the emotions. Emotions is a very important part of ourselves. You know, we cannot, if somebody tells me to keep my mouth off, and that's really bothering me in saying that, then I would keep my mouth closed. And so emotions are a very important part of our physiological dysfunction. So the way we look at it is that we will work on the patients holistically to find out if the structure of the mouth, the maxilla, palatine, the vomer, are functioning properly in terms of are they moving properly symmetrically with amplitude. And we will apply gentle techniques that will go to help to modify this. But not only that, we'll come into the aspect of the emotional aspect, if the emotion is the one that blocks such a structure. So craniosacral therapy is a complementary manual medicine that can be used effectively with any professional in your field as an adjunctive aspect, so that we could help the patient to repristinate as much as possible the physiological aspect of dysfunction, so that you then can put on what is called the finishing touches or the maximum work, with the hope that the body, from your work and from the work that the therapist done, has a more durable or permanent timing of repristination, or to repristinate in a way, on a much more quicker way. So it's a little bit not complicated, but it's kind of an intense thing to talk about, because when we talk about emotion, it's a matter of understanding that if I'm not happy, if I'm in a traffic jam, I mean, I'm in Moscow now, and there's traffic jam every day of the week. If I'm late at the conference, my jaw will lock. And so if this is the case, in some cases we create stress, we create grinding, and so we create a lot of problematic, the physiological problematic. And then working with the physical aspect of releasing the muscle structure manually, but working also with the emotional aspect, which is what I say, the avenue of expression, to be able to express oneself, to be able to release the reticular alarm system, to placate the reticular alarm system, to download the stress amount of it, that will let the mouth to be more functional. So this is a very brief thing, because unfortunately things have changed in my timing. I don't have much more time to talk about this. I've written something more conclusive. Maybe I just like to add something more. In this kind of work, we consider, craniosacral therapy, consider the teeth as bones. And as such, we also consider the teeth and mouth as Chinese medicines. And what I'm trying to say is that each tooth is related to a meridian, and each meridian is related to an organ. And for people that maybe are aware of emotions, we know that if you are very upset, your liver is suffering, and if you're in pain, a lot of pain, your heart is suffering, and what have you. So think in terms of, and I made a documentation of this, and it's been well documented, each tooth is related to an organ. Each organ is related to a meridian. So the craniosacral therapist can work physically on the structure, emotionally on the emotion and energetically on the meridian, to work holistically, and so to help the patient to reestablish as much as possible the function within his dysfunction, if this can be clear.